Have you had an injury to your brain? Are you tired all the time because of it? Are you exhausted? Are you irritable? I'm Dr. Judy Gooch, and I'm here today to help you get better after a brain injury. Today I am here with Nancy Murray. Nancy is a speech therapist and an audiologist. She works with people who have had injuries to their brain, either severe brain injury or more mild brain injuries like a concussion. Nancy is going to talk today about how to improve fatigue after a brain injury. Fatigue is one of the most common symptoms that people experience after a brain injury. People are just really tired and have a hard time doing what they could do before the injury because of the fatigue. In my last video, I talked about brain plasticity. I talked about using brain plasticity to improve after a brain injury, but I said that it takes work to take advantage of brain plasticity. But if you're really tired, you can't work. You can't take advantage of brain plasticity. So it's really important to manage fatigue after brain injury. Nancy, how does fatigue after a brain injury feel?
Most people describe the fatigue that they feel as an overall fatigue. Many people, or even friends and families, describe it as difficulty paying attention to even simple tasks, difficulty finding words, more of a brain function as opposed to a physical function. Oftentimes, family members or the person with the brain injury will describe that they just feel more irritable.
So what are some of the things that make fatigue worse after a brain injury?
That's really a pretty simple answer. Doing too much. And that may seem too simple, but when you think about it, you have to balance what your brain can do and when it gets too tired. If you do too much, the brain is going to fatigue. It could be physical things because, as I just mentioned, you need your brain to even complete simple tasks oftentimes. So it's doing too much.
So Nancy, how should we manage fatigue after a brain injury?
To manage fatigue, there are a few key things that you need to do. You really want to make sure that you are getting good sleep. You want to make sure you're eating healthy and nutrition. That helps the brain heal. You also want to make sure that you're exercising. Exercise increases your heart rate, increases your blood flow, so you're helping the brain heal because that blood is going to the brain and helping it heal, which helps the fatigue. And you also want to make sure with all of these pieces that you have a really good daily routine, some sort of schedule to follow. So you really need to have a good schedule. Your eating, your sleeping, your daily activities or daily routine become part of your schedule. Within that schedule, it is extremely important to put in brain breaks. We all can use brain breaks, but after a brain injury, you really want to put them in more frequently. My recommendation is early on in the healing process, the person with a brain injury actually takes a break every hour, about 5 minutes out of every hour. Brain breaks may be a new concept to you. So what is a brain break? A brain break is sitting back, maybe closing your eyes, bringing the lights down, having a relatively quiet area where you can just do some deep breathing, relaxation, a place where you're not engaging the brain. You're not making the brain work. So that becomes part of that daily schedule. Within your schedule, you want to make sure that you're dividing your activities up. Most people after brain injury need to do physical therapy exercises or occupational therapy exercises and speech therapy exercises. So those get scheduled within your day, and so do the brain breaks. Even things like doing dishes or meal planning, going to the grocery store, any of those tasks need to be scheduled so you can figure out where best to stick in your break, where best to put in some of the other tasks that you need to do. Having a good schedule, making sure you're getting your brain breaks, eating healthy, getting good sleep are all going to help your brain recover.
Patients often tell me that they can't do what they could do before their injury. And this is really frustrating. What should I tell them about that?
You know, I think the most important piece right off the bat is to acknowledge, yes, it is frustrating, and yes, you cannot or they cannot do what they did before. The piece after that acknowledgement, and after the fact that they feel comfortable knowing that it's okay, that they can't do everything, making a plan and setting goals. And that goes back to what I just talked about, the schedule. If someone has a task that they could do before their injury, they can't do now. For example, many people can't go right back to work. Many people can't go back to school. So let's make a plan. Set a goal, set a plan. Have some short-term goals or some smaller goals to get to that plan. But that involves the schedule, that involves taking those breaks, that involves figuring out what are the barriers. Why can't I perform as well at work? Why can't I perform as well at school? Once you sit down with the person with the brain injury and the family members and figure out what the barriers are, then you can make a plan and figure out how do we accommodate the problems, or how do we work on them to improve a particular skill. Sometimes it's accommodations that are needed. Make sure that the person going to school or at work gets their brain breaks. Or maybe they're not ready to perform the task, so you figure out what do we need to do before you can return to school. And you work on a plan so someone can see their progress, they can improve, and you can achieve that goal.
So, after a brain injury, fatigue is extremely common. It keeps people from doing many of the things that they could do previously. But in order to work, to improve, to take advantage of brain plasticity, it's important to manage this fatigue. It sounds to me like the most important points are to, first of all, know that fatigue is normal after a brain injury. And it's okay. It's hard, but it's okay. Set up a schedule so your life is predictable. Don't do too much. Make sure you take regular rests, and also get good nutrition and try to get some exercise.